Hello, I'm Dr. Frances Pitzilis. I'm going to talk to you today about the most common inflammatory bowel diseases. These are Crohn's disease and ulcerative colitis. Both of them run in families and both of them are autoimmune diseases, which means the body attacks its own self. What's interesting about these conditions is that they both seem to have become more common in Western societies because researchers have noticed that in more primitive, basic living societies, these diseases don't seem to exist. And they've suggested possible causes as being and including diet, and stress probably has a role as well as deficiencies. Now, both can run in families, and interestingly, they can both run together within families with the same stable of autoimmune diseases that seem to run together with these. And these include psoriasis, rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, and pernicious anemia. So when one relative will have one of those, another one might have the bowel disease. One thing in particular that can occur with both of these autoimmune bowel diseases is that a percentage of people can be positive for a gene called HLA-B27, and this can be tested for by your family doctor. This gene can also be positive in some people who also have psoriasis, irritable bowel syndrome, and psoriatic arthritis. So when I see some people in the family with these conditions and I see a new patient who has certain symptoms with their bowel, I will always test their HLA-B27. The significance of a positive HLA-B27 is that the diet needs to be devoid of all starch, and that's because the immune system reacts to it in those people. These patients tend to have bowel symptoms, quite obviously, that can, in Crohn's disease, extend from the mouth right through the whole of the gut system to the back passage and the anus. Whereas with ulcerative colitis, it only involves the large bowel and the rectum. So that's what's different about these. And in particular in Crohn's disease, you can often get fistulas or little canals at the back passage that can get inflamed and pussy that the specialist needs to treat. In ulcerative colitis, there's a higher risk of bowel cancer, so those patients need to have regular bowel screening. And in fact, in ulcerative colitis, some people have their large bowel removed prophylactically. Now, we would rather prefer to have dramatic surgical treatments, and that's why doctors tend to give patients drug therapy for their symptoms. But what I think is important about treating these conditions is to also look at aspects of diet and deficiency, which can really make a difference on top of that drug therapy. When it comes to diet, after all, this is a bowel disease, so diet is important, and so is the microbiome, the bacteria around the bowel, especially the small bowel, which dictates to your immune system how to react to the things in your environment. So with these bowel diseases, the diet needs to avoid gluten, milk, yogurt, and ice cream. On top of that, if there's a positive HLA-B27, it should avoid all starch. When it comes to the next layer of treatment, I suggest that these patients have special probiotics to help support the gut flora and help support their immune system. In fact, when I've done that on top of diet and given other supplementation, I've noticed very good results. When it comes to other supplementation for the bowel, a special amino acid called glutamine, which is the most predominant amino acid in the body, is very good at helping to feed the gut cells, help them to work better and help prevent leaky gut, which is where the outside world drips into the inside world, and we don't really want that. Now, on top of that, when it comes to nutritional correction, vitamin D is critical for both of these conditions. The researchers have told us that in very strong terms. In addition to that, fish oil for reduction of inflammation and probably correcting zinc as well. Now, when it comes to hormones, the most important hormone is probably DHEA. That's short for dihydroepiandrosterone. That's why we call it DHEA for short. This is the quality of life hormone, but what's important about it is that as well as all the general quality of life help it gives to the body, it in particular reduces autoimmune diseases and inflammation. So seeing a doctor who understands how to use DHEA is very important. And in men, sometimes also correcting any testosterone deficiency can be useful. So you see, these inflammatory bowel diseases have associations. They can be treated well with drug therapy. We want to try and avoid operations if we can help it. And that's why we need to look at diet, lifestyle, correction of imbalances, and even hormone imbalances as well.